Friends, I am Dr. Hemraj Chandalia. I'll speak to you today about management of diabetes during religious fast. And today we'll discuss the Shravan Fast, which is undertaken by Hindus in the month of Shravan, which usually is July and August by the calendar. So, this particular kind of fast will examine what kind of food free interval is there, what kind of foods are allowed, and how do you change our medication, exercise, and safeguard against hypoglycemia. Now, during Shravan, not all Hindus fast. It is a small section of Hindus which fast. However, that number will be large in our country. And of course, they can either fast sometimes only on each Monday of the month, which is called Shravan Somvar. It's only on Mondays. So then there are only 4 or 5 days. But some of them will observe the whole month of fast during Shravan. Now, very typically, the person doing Shravan fast eats one major meal in the evening. However, certain foods are allowed during rest of the day, and those foods they take in small amount, but sometimes those foods are dairy products and fruits and some of the cereals, and they are all high carbohydrate foods. So remember that although the overall caloric intake will get low in any fasting regime, for that matter, wherever you put restraints, caloric intake goes down because you have to work under certain parameters and time. So, what these carbohydrate food, so that you may not have to change the doses of medicine very much. We should see what foods are to be avoided in the Shravan fast, and in general, all routine cereals we eat like rice, wheat, lentils, pulses like lentils, they are all to be avoided. And of course, some flavoring agents like onion, garlic, or radishes are to be avoided because they are considered traditionally as tamasic in nature, that is not suitable for consumption at certain time of the year. The spices such as methi, turmeric, mustard seed, red chilies are to be also avoided, and all then non-vegetarian foods, that is chicken, meat, fish, eggs, are to be avoided during the Shravan fast. So, what are the foods allowed? So, leave apart those foods we mentioned to be excluded. All kind of fruits and certain vegetables are part of the fasting diet for Shravan fast, like some root vegetables like arbi, lauki, potatoes, the ratalu or the suran. These are used in Shravan fast, and these are of course high carbohydrate foods. And of course, you can use, you see, some other pulses or millets rather, and of course, sabudana is there, rajgariya is there, and makhana and kuttu atta is used, and of course, singara, that is water chestnuts is used. So these are some unusual foods, some millets, and they are eaten during the Shravan fast. In Shravan fast, spices should be avoided, although you can use black pepper, green chilies, coriander, ginger, clove, cardamom, and cumin seeds in all their forms. In this diet, milk and dairy is important. Milk, dairy, yogurt, cheese, paneer, these are all allowed. However, butter has to be homemade butter or ghee. So, sulfonylurea used like lactazide is appropriate in this situation. However, it should not be modified long-acting drug. And what you do is, of the total dose, you divide into 4 parts. So, 1 part is at breakfast, 1 part at lunch, and probably 2 parts at dinner, where there is a heavier meal. DPP-4 inhibitors can continue unchanged. SGLT2 inhibitors also continue unchanged because there is not much salt and water restriction. And medication like insulin, of course, the bolus plan, you see, you can split the doses of bolus again into, if it is normally 3 parts, split into 4 parts. So you take 1 part at breakfast, 1 at lunch, but 2 parts at dinner time. So you split that, and the basal insulin or mixtures can usually continue unaltered. So sometimes mixed insulins are difficult to manage in this situation, like the 30-70, and I think probably a basal bolus plan always offers you flexibility or quick conversion into any situation. Last of all, what do you advise about exercise during Shravan Fast? I think the exercises can be continued at the scheduled time, and there should not be any modification required. So thank you very much for your patient hearing.